Aloha guys, this is Dr. Tom coming at you one more time here. This is our last PowerPoint for this module for pharmacy or pharmacology, and it has to do with substance abuse. So we're picking up where we left off at slide 41, substance abuse, unit 20. Okay, DSM5, what that is guys is the manual diagnostic procedures and diagnoses for mental health issues. In other words, everybody else, all other medical services uses the ICD-10 and that. The DSM-5 is what's used for psychiatric and emotional disorders and stuff. So the DSM-5 categorizes substance abuse and substance dependence. Symptoms fall into four major groupings: impaired control, social impairment, risky use, pharmacological criteria. Okay. How it begins. Tolerance occurs when an increase in both the dose and frequency of use are needed to achieve the same effect. Somebody's been drinking a lot, guys, or using drugs, after a while it gets where they have to do more because they've developed a tolerance to it. Dependency occurs when one or more of the body's physiologic functions becomes dependent on the presence of the abused drug. Some drugs, guys, like heroin, actually makes you ill if you have withdrawal symptoms. You get flu-like symptoms. But something like marijuana, I don't think does, but it can be psychologically, I think, can be develop a dependence, perhaps. Withdrawal occurs when the substance is not taken or ingested. As I said a second ago, with heroin, for example, they used to call it a Jones, like the last name, common last name Jones, where they actually, a heroin addict who was overdue for their fix would actually get physically ill, have fevers and sweats and tremors and so forth. Okay, most commonly used addictive drugs. Marijuana, a psychic effect from THC, tetrahydrocannabinol derived from the hemp plant. Medical marijuana treats pain and nausea, affects euphoria, lowers inhibitions, increases pulse and appetite, poor coordination, etc. I guess, guys, as time goes on, they're discovering more and more medical benefits from it. I personally think it should have never been made illegal, and it most certainly should not be, in my opinion, a Schedule I drug. I mean, by definition, that's one that has no medical use, and we know darn well it does. So, but those wheels turn slowly. Okay, nicotine. What's in tobacco? 60 million U.S. smokers age 12 and older, found in cigarettes and chewing tobacco. Highly addictive. I've read before that the levels of nicotine in the brain starts to subside after 20 or 30 minutes. So that's about when a smoker wants to light up another cigarette. Keep that going. Highly addictive. Nicotine can actually be poisonous. Well, all this stuff can be, but it can be like fatal poisonous. Now, you wouldn't get that from just smoking cigarettes, but most commonly used addictive drugs, club drugs, and inhalants. Let's see, ecstasy. I had to make some notes here. Ecstasy has a chemical structure similar to methamphetamine or mescaline, which is, I think, a derivative of peyote cactus. It's a Schedule I drug, which means it has no known medical benefit. It gets you high from release of additional release of serotonin, one of the important neurotransmitters in the brain. GHB is gamma hydroxybutyrate. It's a CNS depressant. It's also known as the date rape drug, which I thought Rofies were, but according to research I did, that's one too. Rofinol or Roofies is a type of benzodiazepine. It's similar to Valium, a common tranquilizer that's been utilized for a long time. It's the one I thought is primarily the date rape drug, because it also, one of the things it does, guys, it produces amnesia about the event. Not totally, but so if a person was abused in some manner while they were under the influence of this, they may not remember enough of the details to be able to do anything or bring any legal charges, that kind of thing. Ketamine. It produces a high, it distorts sights, colors, and sounds. That's all I found about it. Methamphetamine is, of course, speed. It can be highly addictive. I've vaguely known some people who were addicted to it to the point where they'd scratched their face and had big sores and stuff. LSD, been around quite a while, is a hallucinogenic medication or drug. It say it has no medical benefit, but I think it might have. There's been some research done that suggests it might. Inhalants, most common in young children, middle school students, teens. I'm assuming they mean like sniffing glue and things like that. That's wild that a middle school kid would be doing that, but I guess so. Amphetamines, speed. Intended effects: increased alertness, elevation of mood, appetite reduction, decrease in fatigue. They used to use it to treat obesity, guys, because it just makes you where you're wound anyway, and you're not sleeping much, and you don't really want to eat much. Legal uses: obesity, narcolepsy, which is sleepwalking, attention deficit, or hyperactive disorder. Now, guys, I know what you're thinking. You're saying, Dr. Tom, why, if you have somebody that's hyperactive and they're already, would you give them speed? Well, in children, it activates the inhibitions to bring them down. So rather than making them speed more, it kicks their inhibitions into high gear, so it hopefully tapers down the hyperactive. Okay, highly addictive, damaging to the body over time. However, I do think that there's times that they're effective, like in military situations, wartime. They're issued. I was never in war. I was in the Army in between conflicts. Just that happened to be the age I was. But if it keeps you alert and on the battlefield, guys, it's well worth it, and it is used for that. That's where lives are on the line, so we can dispense with the morality and nonsense and something like that. Most commonly used addictive drugs. Methamphetamine, symptoms similar to amphetamines, but more pronounced. Effect lasts 6 to 8 hours, may cause violent behavior, smoked almost immediate reaction, injected almost immediate reaction, snorted high within 3 to 5 minutes, and they snort it like cocaine. Oral ingestion high within 15 to 20 minutes. There's a euphoria associated with it, guys, and some people, it seems like this really bites them. Meaning they start doing this and they really, really want it and become addicted to it. And I knew a guy that was very successful in the timeshare business and was in an area where he was doing very well. He had a good-sized company, was respected by the owners of the timeshare, making a lot of money. He was already rich, I'm sure. And he started doing it. He was in his 40s, I guess. And a few months went by, and I saw him at a party, and he had sores on his face, scabs and stuff. And I don't know if they itch or something, guys, but I mean, it was bad. And that had affected his relationship with the people he did business with and all. I don't know whatever happened. It's sad, though. Most commonly used addictive drug, cocaine, is a central nervous system stimulant, sniffed or snorted. Crack or freebase can be smoked. I don't know much about that. I mean, of course, I've heard of crack cocaine. Adverse effects include perforated septum. If you do enough of it, and that takes quite a bit, guys, it can eat the septum here between your nostrils out. Chills, fever, ventricular fibrillation, heart beating too fast, psychosis, respiratory and circulatory failure. Yeah, I mean, I'm not doubting any of that. I think it takes a lot, quite a bit. I think if a person had some heart problems, in middle-aged or older type person, and started snorting some cocaine, they could be possibly in danger. But a lot of these, I think, you'd have to do quite a bit of it. Some people seem to be very, what am I trying to say? Become addicted to it easily. Some don't, it seems like, too. So, narcotic, analgesics, opiates. Guys, this is the big one. I'm originally from the South. I spent most of my life in the South. And this stuff is terribly abused there now. And for some reason, these pain pills are the drug of choice for these people. In other words, of course, they smoke grass and do anything else they can get a hold of. Xanax and Valiums and all. But what they really want, and I've been told this by people that own or are affiliated with rehab centers, They want those darn pain pills, and I don't understand why. But I mean, they'll do anything for them. So I mean, I think that fuels a lot of the crime in some of these places. And it's probably that way in big cities too, but I know in these little country towns, it's just sad. 40 years ago, it wasn't that way. Smoking a joint and drinking a little wine or beer on the side, that was the excitement. Okay, more than 2 million people in the U.S. suffer from substance abuse related to opioid analgesics, painkillers. The sad part too, guys, is there's a genuine need for these painkillers. Imagine going and having a bunch of dental work done and then not being able to have pain meds afterwards. You'd be climbing the walls. When you're injured or hurting badly enough, or a cancer patient, or somebody that's been in an auto accident or a fall, and you can't sleep at night because of the discomfort, in a couple of days, you're going to be a basket case. So you need these. There's very much a need for these drugs, very much, but they're terribly abused. Legal use is pain relievers derived from poppy plants, high potential for abuse. Prescription meds include morphine. We've all heard of that. Codeine, like Tylenol 3 has codeine in it. Demerol and Dilaudid. I don't understand the fascination with them, but it's definitely there. And there's people that have thrown everything away for it. I mean, they want these damn pain pills more than anything. I don't understand the desire for them. Okay, let's see, phencyclidine, PCP. All I know about it, guys, is used as veterinary medicine, and it can make people really freak out and gives them like superhuman strength. Legal for use in veterinary medicine. Found as powder, tablet, or capsule, often used in marijuana cigarettes. I guess they sprinkle it in. Causes hallucinations, some pleasant, some not. Fantasy-like effect. Users may injure themselves or die accidentally. So I'm going to jump off this building, man. I'll fly. And then, okay, LSD. No accepted medical use. Yeah, according to the orthodoxy, but they've done some experimentation with it with people with a variety of mental illnesses, and I know very little about this, but I think it does have potential. Acid, well, that's its nickname because it's lysergic acid diethylamide. Schedule 1 drug, which means it's highly addictive, has no known medical value. Alters perceptions. You can hear colors and taste sounds. Now, I don't agree with this last. Suicide attempts are common. I don't think so, guys. No. Not for somebody that willingly doesn't know what's going on. There was an instance years ago where the government the CIA slipped LSD into a punch at a party where there were some scientists and stuff, and one guy jumped out of a window and killed himself, but I don't agree with this. There's a lot of BS about this. To give you an example real fast here, John Lennon, the great co-founder of the Beatles, said one of the things that they put out a lot of propaganda to try to keep people away from the drugs. But intelligent people, when they read a bunch of hogwash, that makes them skeptical of anything that you tell them. One of the things they've said for years about LSD is that these people years later can have sudden flashbacks. In other words, like you can do a little LSD and 10 years later suddenly, you go on a trip again. John Lennon said, look, I took millions of trips of acid in the 60s. Now, of course, he didn't mean that literally, but a lot. He said, and was around, he was the greatest band that's ever been. He was around all kinds of people partying. He said he never knew a single person that had a flashback. And I tend to trust John Lennon more than I do some of our conventional people. Recognizing substance abuse. They have needle tracks if it's an injectable med. Jaundice because it affects the liver. Yellow skin and eyes. Whites of the eyes. Nasal ulceration from snorting. Dilated or constricted pupils when they shouldn't be. Slurred speech, confusion, impaired reflexes. Neglected appearance or poor hygiene. Like I was telling you about the guy Jimmy that had the sores. Early withdrawal symptoms. Last slide. We've got to hurry. Substance abuse in the workplace. 10 to 23% of Americans abuse drugs and alcohol in the workplace, which means they come to work high or drunk, or do it there. Warning signs: deteriorating performance, poor attendance or absenteeism, change in attitude or physical appearance, increased health and safety hazards, emerging domestic problems. I'm of the opinion, guys, that what a person does in their own time is their business, but they shouldn't drive or operate equipment, and they shouldn't be at work impaired. Okay, that's it. Read over it. Dr. Tom signing off.